Hi everybody. Since the COVID-19 situation is not allowing us to get together to do the mandatory in service, we decided to do it via YouTube. And this time I have a special guest to talk about how this situation is affecting the residents with dementia. I'm going to introduce our guest. Her name is Luciana Mitskun Weston. She's a public health educator, mediator, author, and memory care specialist with over 25 years of experience in brain health, memory, and dementia care. Luciana was the Alzheimer's Association educator and care specialist in Santa Barbara, where she developed educational and supportive programs for families and professionals caring for those affected with dementia. Currently, Ms. Mitskun serves as the Director of Community Services for Villa Alamar Memory Care, where she provides family support and health education, while still contributing as a public speaker and educator for Alzheimer's Association. She's the author of Ahead with Dementia, also available in Spanish, Un Paso Adelante de la Demencia, and Ahead of Memory Loss books, offering comprehensive information for caregivers and patients affected with dementia and memory loss. Please, let's welcome our guest, Luciana Mitskun Weston.
Thank you, Victor, and hi, everybody. Thank you for having me. As Victor was saying, it's my specialty to work with patients with dementia. And in my present position at Villa Alamar, I am the main liaison between the faculty, the staff, the patients, and their family members. Now, this epidemic has been specifically hard on anybody who is either hospitalized or living in a care setting. Our care setting is specifically memory care. I understand that you may have some patients amongst yours who do have some problems with memory care. And these are patients with either Alzheimer's disease, with Lewy bodies disease. Maybe you have a patient or two who have vascular dementia or frontotemporal dementia. These are very different kinds of dementia, but these are things that are commonly present in any care settings where you have people who are older. You will be encountering this kind of conditions. And there's another kind of dementia that you might be encountering too, which is a transitory dementia, one that happens when a person is taken out of their comfort zone or their own family lives, and they have to go through treatment. They have to be in a nursing home setting or a skilled nursing facility. And that kind of dementia is a dementia that may occur very quickly. So a person is normal, and then all of a sudden, overnight, they start developing some symptoms of dementia. They can't remember where they are, who they are, why they are for. They start fighting their caregivers, and later that dementia is going to resolve yourself. So that's not a progressive dementia, but it's a transitory condition of the brain. So you might be encountering all these different things, and all resume to the same. These are people who may not be able to understand why they are there. They may not be able to retain the information of who you are as a caregiver and why you're there. They many times don't know, why you are touching them, and why are you wearing that mask. They may think that they are there because they're being punished for something wrong that they have done. So all those things could be happening, and with the COVID disaster on top of it, now the family can't come to see them, and you have to wear gloves and masks and all the protection and keep as much apart as they. So you, this whole situation is forcing us, the caregivers, to add another layer of discomfort to people who are already uh, fighting and being challenged to just go through the day, just understand what's going on. So let's just separate a little bit of the some of these issues that are going on. And the first one is what kind of condition this person is encountering, because on top of the physical ailment that they are under your care for, you are working right now in a skilled nursing facility. Probably this person has been through the hospital and is going to stay with you for a period of time before either going home or going into a care facility that provides a lesser level of care. So it's still a transitory. So you're already getting somebody who is out of their comfort zone. And we need to know, it would be good to know what kind of condition they are facing in terms of their memory. If it's a person with Alzheimer's, they are very not likely to understand. So your first instinct of a caregiver is to explain to them why they are there, to explain to them what it is that you're doing, and that's not going to work. And the more you explain to them, the more agitated they will be. So the better thing to do in that case is not to explain anything and just proceed with your care with a big smile in your face. And if you have a mask that's covering your smile, smile with your eyes. You know, there's always ways of conveying warmth and welcoming to the patients. And just announce every step that you're doing. You know, I'm here to check your temperature. Here is your lunch, or we're going to get your laundry out. Announce it out loud, and make them understand that you're there to help by announcing step by step what you're doing. A person with Alzheimer's, and actually all forms of dementia, a person with Alzheimer's in particular is always scared. They are afraid, and that's part of the disease. They are afraid because they are not understanding what's going on. They are not understanding what's expected of them. They are afraid at all times. And as caregivers, it's our job to minimize that impact. Of course, the COVID adds a little level of scary to it, because we are scared ourselves. We are just humans, and we are scared for ourselves, for our family members, for our colleagues in the working space. But we have to check this all at the door and don't bring into the room for the patient. Because if we let the patient know how scared we are, the patient will double that and will get back to you with a behavior. So when we see patients responding to with a bad behavior that makes them a little less manageable, is either because they are going through a physical pain, and you are experts in realizing that and taking care of that. That's why they are here. It could be also because they are reflecting back to the caregiver some anxiety that they see on the caregiver. So the best thing to do is check your anxiety and your fears at the door. Don't bring in. Every time you come into a room, a big smile, and a big warm, put warmth in your voice. Use terms of endearment. My dear, and compliment. You look so nice today. Look at that pretty hair. No, compliment on anything, even if it's a pattern on their sweater. Make sure they know that you are there as a friend. Of course, COVID is the opposite of everything that we do in terms of dementia. In dementia care, we are warm, we are friendly, and we hug, we kiss, we touch, we massage. We have a physical presence that it's very comforting for the patients. With COVID, we have to take it all out. So those things are not going to happen. So we compensate on the other side by being extremely warm, extremely friendly. Let them know in advance why you're there and what it is. Introduce yourself every time. And they might be asking you questions. Where is my wife? Where are my kids? Why are they not coming to see me? And depending, now it's the other part of it, depending on the kind of dementia and depending on the patient, you need to tailor your response as a group. Because if I come to the room and tell to a man who is asking, where is my wife? I tell him, oh, there's a virus outside, she can't come to see you. And the next person who comes in and he asks, where is my wife? The next person says, oh, she's out with the dog, she will be here in a while. So now these men have two conflicting stories, and they will just add to his confusion. So what we want as a team is to find out what is the most soothing and appropriate for that particular case. Alzheimer's patients have a very hard time learning new information. In other dementias, new informations may stick. So analyze who the person is and what would be the best solution, and work as a team to provide a consistent story for that particular patient. So if for that particular patient the best answer would be your wife is out of town but she sends you love, and then you can show a card that she has signed. Some people are making posters saying how much I love you with a little poem. Then you can show something like that. If that's the best option for that particular patient, have all your caregivers, all your staff combined saying the same thing. So it's part of our training to make sure that everybody's on the same page and everybody is giving the same answer. The same answer will come as news to that person every time. Every time he hears it, he will hear it for the first time, and it's going to be soothing for him. So one caregiver enters the room and he says, where is my wife? Your wife is out of town, but she sends you love. Look at this pretty card she sent you. 10 minutes later, another caregiver enters the room for some other reason, and he's gonna look, where is my wife? To him is the very first time he's asking, because he's already forgotten what the answer was. And what is the next caregiver going to say? Your wife is out of town, but she sends you love. Look at this pretty card she sent you. So the repetition in the same words and with the same pattern of information will be soothing for him. So there will be less likelihood that he will respond to you in an aggressive way, in an agitated way, or with some anxiety. So coordinating with all the caregivers, one by one, how to do that answer is very important. For another person, maybe he doesn't have Alzheimer's. Maybe is a person with frontotemporal dementia. That's a little difficult in terms of behavior. You have to be a little more realistic. And so what would be the answer for another person? Differently, it's going to, where is my wife? The same question, but it's another person. This wife is never out of town. Or you can say that the wife is doing errands, the wife will be here soon. Or, combine the best story for that particular individual. So in terms of figuring out what you're going to say is, what is the condition, what is the disease that's causing. With Alzheimer's they can't learn, so be asking the same thing over and over. With vascular they may be able to learn, and with frontotemporal they may, and with Lewy bodies, who knows, each one's completely different. So analyze the individual, see their needs from the heart. What are they? Are they asking about the wife? Are they asking about the pet? Are they asking about the children? Or they simply want to get out of here? Many times all they want to say, I want to get out of here. So realize that they are afraid, they are scared, and you're not helping by not being able to touch them and be warm with them. So let's help them with figuring out, everybody as a team, what's the best answer to quell their anxiety, and as a group together provide it consistently every time. You may also want to talk to the family members, since they are not able to visit these days, which having family members visiting help us all as caregivers so much, because help them release the anxiety, feel loved, gives them an outlet to touch somebody and to feel part of their family. Now they don't have that. We are their family at this point. But we can coordinate with their family members in terms of getting information about the individual and getting mementos that will remind them of what is, that they are loved and they are belonging to a family unit. And it could be a photograph, it could be cards, it could be messages, it even could be their favorite treat. So have the family deliver those items to the patient, and refer to those items when they feel lost, when they feel scared, when they feel alone, and say, why is my wife not visiting me? Where is my daughter? Why is she not here? So you can show a picture. You take those 2 extra minutes to make sure that they are they are having their emotions attended to, because right now our job is not only take care of their bodies, we have to take care of their emotions, of their heart, their spirit, that is so much there, and they are in a big chaos and much fear. There's much fear going on. So you check your fear at the door, don't bring the fear in, and talk to their fear in terms that they are wanted, they are safe, and they are loved. And use the family and the resources that the family may bring in to show to them, remind them with a physical object that people are thinking of them, they are loved, and they are wanted. Many times we are not going to be able to spend much time with them, and that's understandable, but those 2 extra minutes will go such a long ways. So next time another caregiver comes into the room, they are not going to be so scared. They are going to be less scared, and they're questioning again, where's my wife? It's not going to be coming from a desperation. Is going to be more a routine, and they want to hear the same answer over and over again. And just those 2 minutes that we can provide to them is going to go a long ways of making them feel good. You will have to use less medications for anxiety, and you will have less problems with difficult behaviors if you do just that every time you come in. This is mainly the things that I wanted to talk about to most caregivers. One thing that we're doing at Villa Alamar, we are, and I don't know if you will have the means to do that, but we are facilitating encounters with family members over the internet, over FaceTime, We even have a window visitation program that we can bring our residents to a window and they can see their family member on the other side and they can talk to them over the telephone. So we have a caregiver on the other side, a family member on the other side of the window with a telephone talking to the person inside over the telephone, but they are communicating visually through the window. And it's a great way of having that additional help that the family members bring in terms of soothing emotionally. We're doing a lot of FaceTime, and my job has also become, to soothe the family members, because it's a horrible situation for the family member too, not being able to be there at the moment of great need to that loved ones. They want to be there. They want to be there holding hands. They want to be there, with the straw in their mouths, helping them drink the water. So those simple acts of love and care are so soothing for both patient and family member, but can't happen now. So the family members are a little lost more than they usually are in these situations. Having them, giving them ways to actually see their loved ones has helped a lot for us. And most of my time now is spent in facilitating the communications between residents with dementia and their loved ones on the outside of the facility. For that, the internet has been great, using Zoom, using FaceTime, and using meetings from Google, all kinds of ways of doing that. And sometimes even just a phone call. Just don't forget to sanitize everything after it happens, because especially people with dementia, they may not have the COVID, and hopefully they won't, but they have all kinds of other germs too. So everything has to be sanitized despite of the COVID epidemic, just generally. And I believe Victor might have a few questions for me at this point, and I'll be more than happy to respond. Most of all, I want to thank you for everything that you do for your patients and as a group with your colleagues. I know these are hard times for everybody, and people are being very appreciative of nurses and people in hospitals and the staff at the skilled nursing. Sometimes we feel that we are being left behind and unsupported, but you're not. You are so appreciated, and thank you for everything that you're doing to keep your residents and your patients safe, from the bottom of my heart.
We thank you very much, Luciana, for your time and for your experience to help us how to understand better those patients with dementia and how this horrible situation of the COVID-19 has been doing in our community. For our staff at the Californian, once you finish this video on YouTube, you will have to do 4 questions quiz, and just turn it back to me, and it'll count for your mandatory service. Again, thank you very much for watching this video, and please, our recommendations: keep hand hygiene, keep using the hand sanitizer, and don't forget to use your mask, not even in the facility, which now is mandatory, but when you do your shopping or going to the pharmacy or grocery shopping, please do that. Together we can make it happen. Together we'll stay and we'll be okay. Thank you very much, and have a wonderful time.